I'm honored to be here and appreciate the opportunity to share some thoughts. And many of these are meant to be thought-provoking. They're not meant to suggest these are necessarily the opinions of myself. But what I want to do is to prompt the audience members to think about some of these contexts, and particularly as they relate to some of the options we have available to us to attempt to manage risk, and often in the absence of not just complete information, but a paucity of information. I'd like to continue on Scott Brown's discussion of the risk associated with having the name Scott anywhere in your name. One of the things that quantitative risk assessors often do is rely on, well, some of the theories of statistics that fall back on probability and counting rules. And combinations are one thing, that is the choice of names that you ended up with, but permutations, and that it relates to the order of the name, is actually exceedingly important. My parents blessed me with 3 names. I won't tell you what the H stands for in H. Morgan Scott. 3 names that could be used either as a middle, a first, or a last name. So I could be Scott Morgan, but I'm pretty sure that Scott couldn't be Brown Scott, at least not in our culture. So I am Morgan Scott, and I'd like to talk to you about some of the expectations, some of the results, and maybe some of the conundrums we face with trying to manage resistance. In the program, you'll see I'm going to talk about some surveillance, what we do or what we expect that we should do with those data, and how we might use those data both to canvass the situation in the bacterial populations and then ideally to manage it. Some of the underlying scientific principles that we should be using to manage resistance at the animal, at the farm, the industry, and at the national, international levels. And finally, and I'll try to keep this brief, talk about the conflicting pressures that many of the speakers have already mentioned, that we're trying to conserve critically important antimicrobials for human medicine, but at the same time, some of the risk management practices that are underway and sort of pending legislation might be pointing to trying to restrict access to perhaps less important antimicrobial options, and what that does in terms of narrowing the pressure, as Scott alluded to, by focusing on a very narrow range of remaining antimicrobials. So surveillance, I won't go into detail of this, but most of us have heard of the idea of surveillance. But surveillance isn't just the passive or active collection of data and its analysis. True surveillance actually involves a pre-specified plan to act when some sort of critical threshold or disease detection has been put in place. And so when we talk about surveillance of antimicrobial resistance, it is a very rare situation in animal agriculture or even in population public health where we have a pre-specified plan to act. I'm not saying they don't exist, but in most cases they don't. So the correct word is actually monitoring. And the monitoring system that I'm most familiar with and that relates most to animal agriculture in the U.S. is called the National Antimicrobial Resistance Monitoring System, which is a joint effort of CDC, the USDA, and the Food and Drug Administration. And amongst the purposes or the objectives of NARMS is to monitor trends in resistance amongst foodborne bacteria from humans, retail meats, and animals, and also to assist the FDA in making decisions. So the purpose of this monitoring system also does involve some action, although it's not pre-specified. Now, I didn't mean to pick on the product of one of the previous speakers. I've used this simply because of 2 things. One is the graph is useful because it shows the introduction of an antimicrobial during the period in which I've been involved in animal agriculture. I'm a 1988 graduate of a veterinary college in a country north of this country. Naxel was approved in 1988, the year I got out of vet school. That was a short-acting, daily, if you will, preparation of ceftiofur, a third-generation cephalosporin. In 1996, a longer duration, ready-to-use formulation was introduced, and in 2003, I believe it should be, a longer-acting preparation was approved. Now, NARMS started in 1998, and at least in the first year of surveillance of Salmonella in cattle, there was 0% prevalence of resistance to this antimicrobial. As you can see, though, over time, it gradually increased, and the red line represents diagnostic lab samples of Salmonella, all serovars, and the blue lines represent the slaughter samples, so perhaps more representative of what one might expect to see in surveillance of slaughter facilities. Okay, so that's long-term surveillance. Now, the other graph that many of you may be familiar with is data rising from the province of Quebec in Canada, and these represent 3 lines. The blue lines are Salmonella Heidelberg retail chicken isolates, of which 70% were resistant to ceftiofur in the period of late 2004. The red lines represent human Salmonella Heidelberg isolates, which peaked slightly after that period in mid-2005 at about 60%, and the green are of an indicator organism. Those are what we call commensal or non-type specific E. coli, which were somewhat lower. This graph is used because it has both monitoring and it has an action, and in this case it was a voluntary action to withdraw in novo injection of ceftiofur in broiler hatcheries, which many people would like to believe, and the evidence is perhaps compelling, led to a precipitous drop in the levels of ceftiofur resistance, at least expressed as the proportion of bacteria resistant to ceftiofur following the voluntary withdrawal of this product. Okay, so keep this in mind when you're looking at surveillance where there's actually been a prescribed action, whether it be voluntary or involuntary, as to what the effect or the perceived effect was, and ask yourself, will this happen in all cases? Because that really is what we're after here. Do all risk management or interventions yield such a dramatic response amongst all of the indicators in this surveillance system? So does surveillance assist in decision-making? An example of ceftiofur resistance is the pending since 2008 final rule of the USDA regarding a potential ban on extra-label cephalosporin use in food animals, which, as far as I'm aware, this still is not resolved 3 years on. Okay, but again, an action taken on the basis of surveillance. And one could argue that was that based on surveillance in the United States with respect to ceftiofur resistance, or perhaps from some of the data from Canada, from the CIPARS surveillance system. Well, it also suggests that it was based on some active surveillance of antimicrobial use by the FDA. That is a survey of broiler hatchery operations with respect to the use of ceftiofur and gentamicin in ovo. Okay, and it appeared that there was widespread use of these products, which are, at least in this instance, an extra-label use of the product. So did that have an impact on the final rule and the decision to potentially ban extra-label use of cephalosporins? I'd also draw your attention to this graph, which often is buried in the CIPARS report, and specifically this part of the graph, which you can't see, but if you focus on the blue and the purple or magenta lines, that is that waterfall effect of ceftiofur resistance, but also ampicillin resistance dropping off following the voluntary withdrawal of in ovo ceftiofur injections and subsequent rise, which occurs in 2002, 8, and 9, but also a reciprocal rise, if you will, in streptomycin and tetracycline resistance. Okay, now we have to be careful because the y-axis is a proportion, and if the proportion has to add up to 1, if you take one thing away, something else fills its place. Okay, that's the problem with percentages, and a lot of people don't pay attention to that. But the reciprocal increase in this case was to replace Salmonella that were resistant with ceftiofur and ampicillin and replace it with streptomycin and tetracycline, which I might also add, a recent massive ground turkey recall in the United States was Salmonella Heidelberg that was multi-drug resistant to 3 antimicrobials. Those were tetracycline, sulfas, and streptomycin. Okay? Not ceftiofur and not ampicillin. So I always like to sort of invoke a little bit of Eastern mysticism when I talk about resistance, and part of that's because I don't understand it, either of them, necessarily well. But I like to use this yin and the yang, which is to say, if you think about susceptible and resistance, okay, susceptibility and resistance, you really can't have one without the other. Okay? To talk about resistance means there has to be susceptibility, and to talk about susceptibility means, at least in theory, there has to be something known as resistance. Okay? So you can have a lot of a little, meaning on this part of this small amount of bacteria, if you will, enteric bacteria, you can have a lot of susceptibility or resistance, or you can have a little of a lot. But this becomes incredibly important because what happens oftentimes when we treat animals is we reduce the total number of bacteria that are present in the gut. We can remove 2 logs, and that won't mean much to most of you, but we can literally remove 99 million bacteria per gram of feces simply by injecting them with ceftiofur. And what remains may appear to be a higher proportion of ceftiofur-resistant bacteria, but in many cases, the actual number of bacteria hasn't changed all that much. Okay, so I'm going to skip through a lot of this. I just would mention that the current risk analysis paradigm which we tend to talk a lot about the quantitative risk assessment, is only one component of the risk management, which is throwing it in the political sphere, I think it was mentioned, the risk assessment and also risk communication. Now, I'm going to lay my bias on the line and suggest to you that I think that risk assessments are particularly well suited to things like toxic releases of air pollutants, for example, or even microbial safety in the context of importation and food and animal health. But I argue that while there are appealing aspects of this release and consequences model, this linear model of risk assessment that was up there yesterday for quite some time, I think there's some aspects of it, at least in terms of the timelines and the timescales that we ought to be thinking about with respect to resistance, that it doesn't handle particularly well. It doesn't handle the aggregation from the individual bacterium through the animal, through the farm, to the region, to the industry, to the nation very well. And it doesn't handle the timescales upon which actually the shifts in the baseline levels of resistance are actually occurring in these populations. So, here's the thing. It's been mentioned before. Resistance is uniquely non-linear. Okay? It doesn't occur with a nice regression line that says if you add this much more antibiotic, you get this much more resistance on a straight line. The other part of it is that actually we're talking about separating values from science, but the problem is that the science is values. Because the idea of restricting use is based on the idea that I'm going to conserve use, not use it today so that somebody else can use it tomorrow. So it's a values-based judgment that actually involves this non-linear process. Okay? That's key. Think about that. Because if we make these decisions, that's what we're trying to do. We're trying to conserve it for future use. I don't spend $1 today on candy, so maybe it'll gain some interest and I can spend it on my kids' college education in the future. But what are some of the unintended consequences we need to think about? Okay? Think about these, and think about these with respect to Dr. Flam's presentation yesterday and others. When you're talking about human medicine, we're most often talking about target pathogens, the bacteria that we're trying to effect a change by killing the susceptibles, ideally, and maybe even exacting an improvement in the patient's condition, is a targeted pathogen. When we use the antimicrobials in animal agriculture, we're trying to do the same thing. But the focus in this room is most often not on those targeted pathogens. The focus is on the unintended consequences on the gut bacteria. We're most often trying to treat pathogens in the lung for bovine respiratory disease. But oh, by the way, these antibiotics have an effect in the gut. Okay? And because of the food safety consequences, that's why we're here. Okay? So, this offers both barriers and opportunities to manage risk. Okay, if only we'd thought about this when we were designing antimicrobials, maybe we could have come up with products that actually had an effect in the lung, but not in the gut. Okay? So either the effect on the gut and the bacteria can be a desirable effect if we're dealing with an enteric pathogen, or perhaps it could be problematic. So I discovered that, in fact, if you Google using images, you can find a number of images. And this is our famous Dr. Apley, and I want to peel back some of the layers of the onion, I'll call it, from his talk yesterday. Okay, and an onion is actually a really useful metaphor because it's a great, aromatic, tasty vegetable. Okay, but it can cause problems when you're working with it, including tearing of the eyes, and some people don't like its odor. Okay, the onion I'd like to talk about is the first layer, which I call irony. Dr. Apley presented results from in vitro studies using chemostats and then also some trials of up to a half a year that suggested that there was a point at which tetracycline got so low that you couldn't measure, or we couldn't measure, the impact. Okay? And that tended to be for the subtherapeutic growth promotion uses of tetracycline. There was also a higher level for prevention and therapy that actually resulted in measurable impacts on the gut flora. Okay? Now, I call that ironic because while there's no measurable effect of the low dose on this core tetracycline on the gut, that's actually likely the desired effect. Okay, this is one of those things where we don't really know why growth promotion effects occur from low doses of CTC, but it's highly probable it's doing something to the non-cultivatable part or portion of the gut bacteria. Okay? So, we don't desire an effect, but that's probably what the effect that we see that we like is due to. On the other hand, we have a measurable effect of CTC at 22 milligrams per kilogram. I think that was the dose he said. But that's actually not the desired effect. We're targeting the lung. We're trying to make the animal better with BRD or prevent it from getting BRD. We don't care what happens to the bacteria in the gut, by the way, but there is an effect, and it's measurable. So I actually call the second layer of this onion opportunity. Because in the future, if we want to design products, actually think about how are we going to do this, what we should be looking at is either having products that don't have an effect in the gut that have an effect in the lung, or design other products that can actually quench the effect of these antimicrobials in the gut. And then we'd be done with this problem. We wouldn't be done with the first problem, which has to do with the unintended consequences that improve growth promotion, but we could certainly solve the second one. So, I'm going to ask two deceptively simple risk management questions. The first question being, if we start using an antimicrobial, or use more of it, will resistance to that antibiotic appear or else increase from current levels? Okay? Now that's deceptively simple, but the answer depends. It depends on this. First of all, it's the time scale. So these are data from a study by Lawrence et al. In 2007, and I focus on the blue lines that show a transient increase using a long-acting product, a third-generation cephalosporin, to peak at about day 6 at 40% of the E. coli resistant to ceftiofur, diminishing to essentially 0 by day 28. Okay, so the effect we would see is that we favor resistant bacteria, the levels rise, and then it diminishes to negligible levels, or it returns to baseline. The thing that most people don't focus on is that impact, most of it is actually by killing off susceptible bacteria. So the increase in the percentage that are resistant actually has very little to do of expanding the population of resistant bacteria, and almost everything to do with killing off the susceptibles. In fact, close to 2 logs, which at this level is in the realm of millions of cells. Okay? So what does that mean? Well, food safety risk really isn't about whether the bacteria is there or not on the carcass or on the finished product. It's about how many are there or not. Okay, because there really is a dose response associated with salmonellosis, campylobacteriosis, and most other foodborne pathogens. Okay? So we can measure the effect in the short term when we're talking on the matter of days. The problem is the long-term effects, and I relate this back to the quantitative risk assessment, and the problem with this idea of release or new resistance or expanded resistance arising on the farm. The problem is the baseline never really returns back to where it was. Measured on a scale of years and decades, by looking at those NARMS data I showed earlier, they're actually they're major shifts in the bacteria populations and equilibria, and they're not particularly well studied using the methods that we use or in the time frame of the grants that are issued to most academic researchers. So the time scale that you need to look at here is most often modeled, and it's in a matter of weeks, but now 1,000 weeks actually represents roughly 20 years. How many of us are actually going to engage in a single research project for 20 years? Very few people. But if you actually look at it and you use some data, empirical data from closed populations like island populations, these data rise from Iceland, you can actually see the cumulative long-term effects of these. Okay. So the second simple risk management question, and this will be the one that I close on, is to ask the question, and this is the most important question with respect to risk management of antimicrobials. That is, if I stop using an antibiotic, or I use less of it, will resistance disappear or at least diminish? Because obviously there's no point in doing this unless you're doing it for some other values-based reason. Okay? This also depends. And some of this is conjecture on my part, but I like to think it's based on some theory. But a lot of it is based on empirical data. Okay? So this is what everybody would like to think happens. If we cease using this product, if we cease injecting every single egg of 40,000 eggs that are going to hatch into broilers that are going to be placed in a house, if we don't do that to every single egg that turns into a chicken that's going into a broiler house, if we take that away, will resistance go away? Well, in this instance, in Quebec and the province of Canada, at least if you stop observing it at 2007, it does. Okay? But if you look at these data and you compare the NARMS data to salmonellosis and tetracycline resistance, and you ask yourself, what happens if we take away tetracycline? Either the formulations that are used in feed or injectable tetracycline. My question to the audience is, do you think tetracycline resistance is going to diminish, drop? Well, is it going to go away? I believe it wouldn't change very much. Taking tetracycline out of this equation isn't going to change levels of tetracycline because the bacteria have become so adapted to it, it doesn't confer a fitness cost. Okay. So the last thing to think about is what are the other drivers of resistance? And these data are from a colleague of mine, Guy Lonergan, who isn't here. But basically looking at animals coming from one production component of the system, and this is extensive agriculture on the far left, coming with relatively low levels of multi-drug resistance, being placed into a feed yard but being randomized into 4 separate groups. Those that are a control group, and those are the gray bars. Those that receive 1 antimicrobial, 2 antimicrobials, or one or the other or both. You see that the biggest driver of the levels of resistance has nothing to do with which group you're randomized to, including the negative control group, but most importantly, which environment you've been placed into, and what are the resident bacteria that are present in that system. So this begs the question, even if it has nothing to do with antimicrobials, what would be the impact on changing the environment of these animals, potentially pre-slaughter? Could that actually impact the carriage of the resistant bacteria before we send them on into the food supply? Okay, so I'm going to close just by saying these are the shared perspectives of most people in the room, and they're basically what Scott Brown mentioned. Antibiotics are essential for enhancing the health and well-being of humans and animals. There's a recognition of overuse and misuse in both groups, and protecting the efficacy of these antibiotics for future generations is considered desirable. But the risk-averse perspective says that we should invoke the precautionary principle in the absence of adequate information, and we should curtail this use in the order of, most people would say, growth promotion, prophylaxis or prevention, metaphylaxis, and finally therapy. And I'm just going to jump through the CIAs because we know all about them. And bring you to this perspective. The risk-tolerant perspective says this, that our objective involved in agriculture is to provide safe, nutritious food products, and it's a moral imperative. Okay? Antibiotic therapy in this model, has been mentioned by Dr. Apley, is actually considered as a failure. Therapy means you've let animals get sick. They're probably just the tip of the iceberg. And actually prevention of clinical and subclinical disease is actually what you should be aiming for. Okay? And in fact, we've done surveys of veterinarians involved, as producers involved in the cattle feeding industry, and they overwhelmingly agree that there's a moral imperative for them to use antibiotics, firstly, for treating acutely ill animals. But there is still an agreement, although there's some difference in agreement, that there's also a moral duty to treat these animals to either prevent disease or to enhance the efficiency of their production systems. But the difference between the people involved in the industry, feedlot operators, who obviously have a stronger economic bind to this question, feel there's a moral duty to treat treat animals with antimicrobials to promote growth and prevent disease. Veterinarians probably feel less of that obligation, and part of that has to do with their training and what their oath says to do. But there are differences even on that side of the equation. So